Well, hey everybody, this is Matt Anthony. I'm here with Dr. David Peereboom. Dr. Peereboom and I have known each other for many years, working together with his clinic at Cleveland Clinic and Head for the Cure. And it's always a pleasure, Dr. Peereboom, to talk with you. And we're here. I'm in Kansas City. You're in Cleveland in your office, and great to see you again. Everything going well?
Yeah. Thanks, Matt. Yeah, it's great to be, great to be here, be with you. Thanks for, having this conversation. It's great to talk to you after, several
7 years,
years
I
in the
think. Yeah. So
pandemic and everything. So it's great to be able to chat.
well,
But
we really appreciate it. We're here to sort of get everybody revved up for our 8th annual. Hard to believe that that our 8th annual Head for the Cure 5K in Cleveland at Edgewater Park on Saturday morning, October 7th. We've had as I think back on different years, we've never had weather that has prevented us, but we've had some chilly days. But it's always a welcome fall morning after what's been a pretty hot summer. So we're a month away, and I'm counting on a beautiful fall day on October 7th. So
well, that's what the preliminary weather report is looking really good.
I have a friend that's in the long term weather forecast, and he promises a nice, cool but clear fall day on October 7th. So everybody, now's the time to sort of train up for the event. But this has been a great partnership. Dr. Peereboom, you and I met through the Brain Tumor Trials Collaborative, and I think we talked early about, let's bring a 5K to the Cleveland area. And the purpose of our Head for the Cure events from the beginning was to raise awareness about a disease that is underfunded, which means it can be under-researched, malignant brain tumors, glioblastoma especially, to raise funds, of course, but also to convene people to raise hope. It's been such an honor to work with you and your staff at Cleveland Clinic, and I not only to support the event, but to be present at the event for patients and caregivers. And you might comment about, how important is that as you see patients in the clinic, to encourage them to come together to events like the Head for the Cure 5K and get out of the clinic and just experience what it means to be part of a community where others are sharing the same experience.
Yeah, boy, to a person, this event is, everyone who talks to me about it always says, what a meaningful event it is. Lots and lots of people, tell me, yeah, I'm really looking forward to the event, and so it's a very meaningful event. It does inspire hope, camaraderie. Instead of a patient having to come downtown to the clinic to see us, it's just nice to see them outdoors wearing normal clothes.
Yes.
And just an outdoor setting with other patients, loved ones. And the team here, I mean, it's not just the nurses and the docs. There's all these folks that are behind the scenes that really, make the research happen, allow the research to happen, and the patients get to meet those folks also. And then, that doesn't happen when they come for a visit here at the clinic. So there are a lot of different parts of it that are meaningful, and even the folks who are just happen to be at the park, not involved. Yeah, they see the event going on, and it's it does definitely raise awareness and around the city. So it's a great event, and
it's
patients
so
and families love it.
I'm not from Cleveland, but I've had the pleasure of meeting at your center and seeing it. And for everybody who's seeing this in the greater Cleveland area throughout Ohio, I think people recognize it, but I can say it objectively that the Cleveland Clinic is a pretty special place, and it has a reputation among and well earned among the best cancer centers in the country, really the world. And what you run through the Brain Tumor and Neuro-Oncology Center is quite special. And so I want everybody to know that when people face something unexpected, of course unwanted, the diagnosis of a brain tumor, that the treatment opportunities, the care, the compassion, the empathy that is brought to them at Cleveland Clinic is really unmatched. And then Head for the Cure, as you say, when you can sort of get out of the clinic and take the lab coats off, and then get people into the park with shorts and tennis shoes, everybody's the same, and I think that's, and I've recognized that about you, Dr. Peereboom, is your accessibility and approachability, and I know that's how you run your clinic. So thank you for that, and I might ask you, just to chat a little bit about the evolution of treatment for malignant brain tumors. You and I were chatting a little bit earlier that what Head for the Cure is working hard to do in partnership with Cleveland Clinic and other partners around the country is help patients today, help them understand that they aren't alone, help them find support, help them feel like there's a path toward hope, and also help patients tomorrow by sponsoring and pursuing clinical trials that ultimately are going to solve this elusive challenge of malignant brain tumors. As you think about that, the balance of helping patients today and helping patients tomorrow through clinical research, what kind of gives you optimism and I should say energy, to continue your mission, your work to support this community? Kind of a big question, but I'd love to hear kind of your thoughts on that.
Right. So I think, the brain tumor treatment is definitely, I think over the years, it has been on a steady course of, I would say, improvement, both in treatment and supportive care, symptom management, focus on quality of life. So the medical treatments are a piece of the care, but they're by no means the only thing. There's the whole, the whole, I guess, realm of taking care of folks. And as you were mentioning, giving hope. We've got a lot of scientific advances coming through labs and preclinical studies. And so I think we're blessed that more and more of the basic science discoveries are actually moving into the clinic. And I think that process is happening faster than it used to. So that's very encouraging to us. And, with the clinical trial, our mantra, the thing that does make us tick, our motto is to be able to offer a clinical trial for everybody who walks in the door. And so what we do,
I didn't realize that. That's amazing.
And that's our goal. And that's, that's what we strive for. So we try to have enough clinical trials up and running and in the pipeline so that we can, keep that portfolio active.
That's great.
So
and hearing that, I mean, I think that, and I know this to be true, but maybe, so while Head for the Cure and the Head for the Cure 5K on October 7th brings the patient community together with the medical community and really their loved ones. I mean, that's I was asked recently the simple question: how many people are affected by a brain tumor every year? And I answered it the conventional ways to say, well, there are 700,000 people living with a brain tumor. There are 15,000 glioblastoma or malignant brain tumor diagnoses each year. That's only a small part of the story. What I realize is that for every patient, there are dozens of people that are in their loved ones, their family members, their caregivers that are affected. So there are millions of people affected by a brain tumor, and so to hear your point about there's something for every patient. Every patient is also unique, right? They are part of this community, but you as a doctor treating each patient, you have to understand that every diagnosis is is unique. A glioblastoma is a broad diagnosis, but even in that sphere, there are lots of variability, right?
Exactly. That's right. And let's see. So sorry.
Yeah. So on that point,
Yeah.
yeah, I mean, so in terms of 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 understanding each patient's situation and prescribing a protocol that works for them is, or that you believe is best for them, is that's the essence of how you approach the patient engagement, I assume.
That's right. I'm glad you mentioned that, because with the advances in understanding the molecular features behind a patient's tumor, we're starting to understand more and more about different subtypes. So not all glioblastomas are the same, and we now routinely do molecular profiling and genetic sequencing to try to better define a patient and better match a treatment for that particular subtype of glioblastoma. So that actually is another area that I think it's actually really exciting for us, because I think it gives each patient, if we know their genetic makeup, more than we used to, it gives a patient a better chance at receiving effective treatment. So
that's wonderful, and I think that back again to the Head for the Cure event on October 7th at Edgewater Park, which does bring everybody together, and it's kind of an equalizer, that we're there. And I want to kind of just do a shout out. I for everybody who's seeing this, who maybe first learning about Head for the Cure, new patients or new supporters, others that have been part of our of what is now a traditional celebration for years, come back, because I think that it will be one of your best days of the year. I promise you. It's a celebration. It's while it's a serious subject, it is all about smiles. I don't. It's not possible to leave Edgewater Park after the event on October 7th without feeling good. Don't you agree, Dr. Peereboom?
Oh, absolutely. It's a wonderful day personally, and I know that's true for a lot of the folks that I work with, and certainly for the patients and their loved ones. And
thank you.
So it's a great day, and the way you guys organize the event certainly leads to that tremendously. So
that's awesome. Well, I just like to say to everybody who's seeing this that if someone in your life is facing this diagnosis, or in memory of, we're often put in a position when somebody in our life is facing something difficult, we want to ask them what we can do to help. And frankly, Head for the Cure on October 7th is the answer to the question. Just show up. It's that simple. That's when you show up for someone, especially when they don't expect you. There's no greater gift. And I want to thank you and your team, Dr. Peereboom, for continuing to show up. We're going to continue to show up for you guys. I know you will too, and for all the patients out there. So, and by the way, it is a 5K, it is a run and a walk. And over the years, we have leaned more to more walkers than runners. So if anybody's intimidated by the idea of a 5K, don't be, because we take all comers, don't we? I mean, it's time just for fun, but it's fun just because it's time.
Absolutely.
Any last words, Dr. Peereboom, to encourage folks to come out?
Well, not exactly, except to just emphasize what a hopeful event it is.
Right.
I think it does give a lot of energy to patients and caregivers, because we all know, and you all know as patients and loved ones far better, that going through this is extremely trying and taxing at times. And again, you better than us know that. And so
Definitely.
this is a day that hopefully is a breather, and
Love that.
literally a breath of fresh air outdoors. So we hope that that's part of what this is as well. So
That's great, Dr. Peereboom. I think that's great, a breather for, and that's, again, whether you're coming, whatever part of the Cleveland area you're coming from, land at Edgewater Park before 8 o'clock on the 7th, and for the next few hours, you're going to create memories and know that we've got this great partnership, Head for the Cure and Cleveland Clinic, that, we're raising awareness, we're raising some funding, and mostly we're raising hope. So, Dr. Peereboom, it's an honor to work with you and your team. Thank you for supporting us so that we can support you. I think that's the whole idea. So really appreciate all you do for patients throughout the area and all you do to help Head for the Cure as well. So we'll see you on October 7th. So, and everybody out there, headforthecure.org/Cleveland, quick little donate button, register. And if you're having trouble registering your team, the Head for the Cure team, Reagan and Morgan, can help you get all that set up. So thank you again, Dr. Peereboom. Thanks to everybody at Cleveland Clinic. We'll see you in a few weeks.
all right.
On Saturday morning, October 7th. Great.
Yeah, and thanks so much for all the work that you do. You make this event a lot of fun, as well as easy to participate in and
Great.
be
That's the idea.
for.
We
So
want it to be an easy button. So let's do it.
yeah.
Great. Thanks again, Dr. Peereboom.
Sure, you're
See
very
everybody in a few weeks.